This combination hormone medication helps prevent pregnancy by containing two hormones, an estrogen, ethinyl estradiol, and a progestin, drospirenone. It also includes a folate supplement, such as l-methylfolate or levomefolate, which is a B vitamin that helps prevent spinal cord defects in an unborn baby. Taking this medication, along with a diet rich in folate, can lower this risk if you become pregnant while taking this drug or soon after you stop taking it. In addition to preventing pregnancy, this medication may also help make your periods more regular, decrease blood loss, alleviate painful periods, and reduce the risk of ovarian cysts. It's important to note that using this medication does not protect against sexually transmitted diseases. It's important to take this medication as directed by your healthcare provider and at the same time each day. This will help maximize its effectiveness. Before starting this medication, make sure to read the patient information leaflet provided by your pharmacist. It contains important instructions about when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth once daily, with or without food, as directed by your doctor. Choose a time of day that is easy for you to remember, and take your pill at the same time each day. Taking this medication after your evening meal or at bedtime may help decrease stomach upset and nausea. Continue taking this medication exactly as prescribed by your doctor. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses, as this can increase the likelihood of pregnancy. If you experience vomiting or diarrhea, it can affect the effectiveness of this medication. In that case, you may need to use a backup birth control method, such as condoms or spermicide. Check with your doctor or pharmacist for more details. Your pill pack contains 21 pills with active medication, hormones and folate, and 7 reminder pills, without hormones, but with folate, at the end of the pack. Take one active pill once daily for 21 days, followed by one reminder pill once daily for 7 days, unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. If you start on the first day of your period, you do not need to use backup birth control the first week. Consult your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, refer to the patient information leaflet or consult your doctor or pharmacist. Side effects of Drospirenone-E.Estradiol-Lm.Fa tablet may include nausea, vomiting, headache, abdominal cramps, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. If any of these effects persist or worsen, contact your doctor. This medication may also raise your blood pressure, so it is important to monitor it regularly and inform your doctor of any high readings. Serious side effects can include lumps in the breast, changes in mental/mood, unusual changes in vaginal bleeding, severe stomach/abdominal pain, symptoms of high potassium blood level, dark urine, or yellowing of the eyes/skin. In rare cases, this medication may cause serious problems such as blood clots, which can lead to conditions like deep vein thrombosis, heart attack, pulmonary embolism, or stroke. It is important to seek medical help immediately if you experience symptoms such as pain/swelling/warmth in the groin/calf, tingling/weakness/numbness in the arms/legs, sudden shortness of breath/rapid breathing, chest/jaw/left arm pain, unusual sweating, sudden dizziness/fainting, confusion, trouble speaking, weakness on one side of the body, sudden vision changes, or unusual headaches. If you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are a smoker or use tobacco and are over 35 years old, it is not recommended to use this medication. Smoking can increase your risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like the pill, patch, or ring. The risk of these serious problems increases with age and the amount of cigarettes smoked. It is advised not to smoke or use tobacco while using this medication. Before taking this medication, it's important to let your doctor know if you have any allergies or if you have a history of certain medical conditions. This includes adrenal gland problems, blood clots, high blood pressure, depression, diabetes, heart problems, kidney disease, liver disease, obesity, thyroid problems, and more. If you have diabetes, it's important to monitor your blood sugar levels regularly and inform your doctor of any changes. This medication may also increase your potassium levels, so it's important to speak with your doctor before using potassium supplements or salt substitutes. It's also important to be cautious of sun exposure while taking this medication, as it may cause dark areas to form on your face and skin. If you wear contact lenses, you should also be aware of potential vision problems that may arise. Additionally, this medication should not be used during pregnancy. If you become pregnant while taking this medication, it's important to notify your doctor right away. This medication may also decrease breast milk production, so it's important to consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This medication may interact with other drugs such as aromatase inhibitors, atazanavir/cobicistat, fezolinetant, aspemifene, tamoxifen, and certain combination products used to treat chronic hepatitis C. Additionally, drospirenone may raise your potassium blood level, so it's important to inform your doctor if you are regularly taking other drugs or products that can also raise your potassium level. Some drugs may cause hormonal birth control to work less effectively, resulting in a potential risk of pregnancy. It's important to discuss any new medications with your doctor and consider using additional reliable birth control. Also, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding while taking this medication, as these may be signs that your birth control is not working effectively. This medication may also interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking this medication before undergoing any lab tests. If someone takes too much of this medication and experiences severe symptoms like passing out or trouble breathing, it's important to call for emergency help right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share this medication with others. Make sure to schedule regular complete physical exams, including lab and/or medical tests such as potassium blood level, blood pressure, breast exam, pelvic exam, and pap smear, while you are taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments. Be sure to consult your doctor for more details. If you miss a dose, refer to the package instructions for guidance. You might need to use additional birth control methods, like condoms or spermicide, to avoid pregnancy. If you have any concerns, consult your doctor or pharmacist. If you frequently forget to take your pills, talk to your doctor about switching to a different birth control option. Remember to store your Drospirenone-E.Estradiol-Lm.Fa tablet at room temperature, away from light and moisture. It's important to keep it in a safe place, out of reach of children and pets. When it's time to dispose of the medication, make sure to do so properly by consulting your pharmacist or local waste disposal company. And never flush it down the toilet or pour it into a drain unless instructed to do so. And remember, always discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.